All right, we're back, Dakota Natural Health Center. It's Dr. Stephanie and Alicia. We're doing another video about thyroid health to kind of go along with the upcoming clinic date that we have set aside to do comprehensive thyroid panels for anybody interested. And again, just to be perfectly clear, you do not have to be an established patient. You just have to call and schedule. So please don't be discouraged. If you haven't been here before, you are still very welcome.
Yes.
So we're going to keep this one short, though I think I say that every time, and
Yeah.
short is a relative term in my world. And we're going to do a quick recap on your typical hypothyroid symptoms, and then we're also going to expand on that a little bit to symptoms that maybe aren't always acknowledged as being possibly thyroid related. And you know, the funny thing about the endocrine system is it's sort of like a Alice in Wonderland rabbit hole. Sometimes the more you think you know, the less you actually know. So we always have to, while we think we know what symptoms are related to different dysfunctions, we do have to be a little bit flexible about the idea that in certain bodies there's the potential for different symptoms that aren't common to thyroid dysfunction. So, typical symptoms.
Tired.
Fatigued all the time, even with adequate rest. Cold in your hands and feet. Constipation.
Yep. The brittle hair and nails.
Difficulty maintaining your weight.
Yes, big time.
What are the other ones? We've mentioned depression before. I don't know if you'd call that typical or not. Family history, of course, you're more likely to experience hypothyroidism if you have a number of family members with that type of condition. Other real typical symptoms, dry skin. I guess we talked about the nail and the hair, but dry skin. I guess a typical thyroid cyst symptom that we don't see it clinically all that often is swelling in the hands and feet. In the absence of I've been on my feet for the last 5 hours. It's a little bit different.
Sure.
So those are typical. If we go into other systems that can be affected, there is plenty of other things that we can mention. One example would be elevated total cholesterol, or cholesterol that's more difficult to manage, can be an indicator that your thyroid isn't functioning as well as it could be.
Your adrenals, your cortisol levels.
Adrenal dysfunction. A lot of people have heard of adrenal fatigue or even adrenal hypertrophy. This is one of those cause and effect things. Abusing your adrenals can lead to a functional thyroid deficiency, but hypothyroidism can definitely contribute to adrenal fatigue over time. Interesting relationship there. One thing that matters a lot to me, because I use it a lot, or I do this a lot, is fertility issues. So low thyroid function, even subclinical, meaning we can't actually diagnose it based on typical reference ranges, but it's not optimal. Remember we talked about the difference between fine and optimal, can contribute or can actually decrease a woman's ability to get pregnant. And can also contribute to menstrual irregularities. So heavy periods, clotting, cramping, that kind of thing. Other sex hormone dysfunctions, so symptoms that mimic estrogen dominance or progesterone deficiency. The thyroid is intimately related with how these sex hormones interact with their receptor sites on peripheral tissues. What else are we going to mention?
Muscles, aches and pains.
Chronic fatigue syndrome or fibromyalgia type syndromes, specifically heaviness or weakness in the upper extremities, shoulders, arms. That can be a thyroid
Pain in the neck and kind of chest area.
Difficulty swallowing, feeling like something is stuck in your throat, feeling like you're going to choke, or potentially you do choke when you swallow. What else?
There's so many that it's hard to just list them all because everybody's different. I mean, personally, I've had bouts with all of these things that we've listed. And so you just have to go with, it could be a symptom of your thyroid.
Yep, that's true.
It's not in your head. So.
And thyroid isn't always the cause. We have to remember, sometimes thyroid changes are actually the effect. Like digestive dysfunction can be a cause of changes, negative changes to the thyroid. We mentioned adrenal dysfunction causing thyroid issues. A lot of stress and having poor management of your stress and poor sleep and poor dietary habits can actually cause thyroid issues. So it's not good enough to just say, oh, it's prevalent in my family, or oh, I was diagnosed and told that I just have to take the medication forever. Maybe you do, but has your lifestyle and your nutritional status and everything been evaluated to the extent that we could really validate that claim?
Right.
And we don't always know the answer to that, so that's the kind of tools we're looking to provide.
Yep.
What else? I think we covered most of what we were going to cover.
Mm-hmm.
So here's the usual. If you have questions, if you would like some more information, please post it on this video. We love that you guys are sharing our videos. That is really
Awesome.
excited for us. Our testing times are filling up. So if you're kind of on the fence or thinking about it, I would encourage you to call more sooner than later. That clinic date is coming up on March 6th.
Mm-hmm.
So I think there's maybe only 3 spots
Few.
left. So hopefully, we really look forward to seeing and meeting all of you and encouraging you along this process of getting that thyroid where you need it to be. So thanks for watching.
Tune in tomorrow for the questions and answers.
Mm-hmm.